My name is Sandra Williams. I'm a nutritionist and I'd like to talk to you today about uterine fibroids, part of the Understand to Heal, the Food to Thought series. As I said, I'm a nutritionist. I suffered fibroids for many years and I thought I'd share my knowledge of what I'd learned and hopefully how I can help. I just want to make a disclaimer to let you know that I am not a doctor. I am not in the healthcare profession either. So if you need medical advice or if you're not too sure about something, it's best to go and speak to your doctor. But this is for those who are looking for healing from a more natural source. Okay, so let's begin. Okay, so uterine fibroids. Today we'll be talking about what is a uterine fibroid, possible causes, common symptoms, an intervention study that looks at nutritional therapy, using diet as therapy. We will monitor the results, how to monitor results for the best outcome to find out what's happening, and also a summary of what we spoke about today. So uterine fibroids, what are uterine fibroids? Well, uterine fibroids are called in Latin leiomyomas. They are non-cancerous, a benign solid tumour. As you can see in the picture, they are located in various parts of the uterus. If they're inside the uterus, they're called submucosal. In the muscula of the uterus wound, they're called intermuscular. And then if they're on the surface, they're called subserosal. Depending on where they're located and the size of them, will determine the symptoms you get and also the pain and so forth. They are actually the most common gynecological issue, and they affect up to 80% of females. However, not all of those females affected will be symptomatic, and so won't seek medical assistance, well, need to seek medical assistance. There is a higher incidence rate of uterine fibroids. That being said, there is a higher incidence rate of uterine fibroids amongst the Black community, and it's estimated to be at least 3 times higher than the normal population, So what are the possible causes of fibroids? It's suggested that one of the main reasons might be caused because of a hormone imbalance, the increase of estrogen to a decrease in progesterone levels. That's sometimes termed as being estrogen dominant. As you can, it can occur any time throughout a woman's reproductive years. That's when she's most fertile, particularly having children. So we're looking around about between the ages of 30 to 50, but it does seem to be more prevalent in the perimenopause period, which is around 40 to 50, when the estrogen levels are fluctuating more. Yeah. It's also supposed to be, and it's suggested that, and it says that after menopause, when a woman goes through menopause, then uterine fibroids is no longer an issue. Symptoms do tend to subside. Chronic inflammation, it's been linked with chronic inflammation in the body, which can be set off by many factors, some of which would be stress, some of it would be diet, so it's been linked to a low fruit and vegetable intake. Also, lack of exercise is another factor, and being overweight and obese are common things that seem to be associated with having uterine fibroids. So what are the symptoms? Well, the most symptom that cause women to seek help, medical intervention, is the heavy uterine bleeding. You can have extended cycles, uterine clots. All of this can lead to all of this can lead to a critical state of anemia, which could even be life-threatening. I know in my case, I was actually had to go to I've had to go to the hospital on a number of occasions, and blood transfusion. I had a blood transfusion last time, and that isn't unusual for somebody with the uterine fibroids. Also, infertility can be an issue, as I said, depending on where it's located, or subfertility as well. So there's a range of issues, and on a physical side, you can have an increased abdominal girth, increased circumference, pain in the lower pelvic area. So it's a real burden, and it's a real stress on the ladies, on a woman's quality of life. It's so medical management of this seems to be, so it's not surprising that a woman just, anybody who's experienced fibroids, who's going through this, would just really just want the issue resolved, because it has a real impact on the quality of life and health. You know, lost work for days and so forth. So the medical management, the main medical management for this procedure is a surgical one, and that is a hysterectomy, where the uterus is removed. And that can happen anytime for a woman. That can happen anytime within the reproductive years. So it could be as young as 30, or it could be, you know, in the menopause. Most of the time it's in the menopause, when a woman's coming up to the perimenopause period, but it can happen at any age. So it's quite a major intervention, medical, so it's quite major surgery to control this problem a woman has to go through. So, not surprisingly, a lot of women do not want to have a hysterectomy. I was one of them, and because of that, I started looking around for something else that I could do. And because I was a nutritionist, food seemed to be the obvious choice. So I looked around for various studies, and this is just one of them that I found that suggested that resveratrol, it was a Taiwanese study, done in 2019, that suggested resveratrol had an effect on suppressing human uterine fibroid cells. This particular study was done in vitro in a test tube, and it was also done in vivo in animal models. And it was done over a 5-week period. And what they found, which is at the bottom, they found that it had a potential to be used. What they said at the end, it had a potential to be used as an anti-fibrotic therapy for uterine fibroids. So that sounds like pretty positive. It sounds like pretty good news, positive to me. So I got looking at resveratrol. You know, how could I apply that to my situation? How could I include it in my diet? So interestingly enough, resveratrol is an ingredient that's found in abundance in grapes. It's found in particular in the skin and also in the seeds. So grapes are high in polyphenols, and resveratrol is just one of them. They're grapes, because they're a food, they're generally regarded as safe, but obviously there will be some people who will allergic to them, as there is in all foods. So you could, using this as a diet therapy, it can be eaten as food or it can be bought in the supplement form. I chose to do both to manage my condition. So in terms of self-management, it's a low-cost alternative, and it's something that you can do for yourself, and it's something you can do. For me, it's something I actually did while I was waiting to see the gynecologist. I was waiting for the next gynecological appointment. It's non-invasive, and that's something I liked about it. It's non-invasive. It's food. It's something you have to eat anyway. You have to eat anyway, so why not eat something that's going to be healthy for you? And it actually improved my quality of life, because there are other benefits. Although I was looking to improve my uterine fibroid issue, there are other benefits of eating healthy. You know, it's going to benefit your cardiovascular, your heart. It has benefits on your heart, and lots of other benefits. So anytime you introduce anything new, I mean, using grapes is grapes, or using resveratrol, it's just one piece of the puzzle, shall we say. When you're dealing with any health issue, especially something like uterine fibroids, there's so much things that can affect it. So there's so many moving parts. It's really best to look at it as overall strategic approach to managing your health. So one thing which I found useful was monitoring the results, monitoring my health, and in particularly monitoring your menstrual cycle, because this is one thing I found that the doctor always asked me. They always asked me, when was my last period? How long has it been? How heavy? They asked quite a few questions, and I could never really answer them because I wasn't really tracking it. So I think being able to track it, once I started to track it, because I wanted to start to manage the symptoms, I was able to see where I was improvement, or I was able to see where things weren't going so right, And this is really, really, really important if you're somebody that has suffered from anemia, iron deficiency anemia, because of blood loss. You need to be, it's best you can know when to seek medical help. Don't leave it too late. Maybe if I'd been able to seek medical help sooner, I wouldn't have needed the transfusion, because my iron levels were so low. My iron stores, not even my iron levels, my iron stores had been so low from successive periods of blood loss, of long extended periods. So this monitoring, this menstrual cycle log, is available as a download So if you want to start tracking your cycle, it might be beneficial. You might find it useful. It's a free download. So in summary, uterine fibroid is a common gynecological condition, and it affects women in their reproductive years, and there's with a greater incidence rate amongst the Black community. The disease has a negative impact on health and the quality of life of the women, with 75% of those who are medically managed undergoing surgical hysterectomy to control the condition. Experimentally, resveratrol has been found to suppress uterine fibroid growth, and it can be used as a wider diet therapy approach for women who want to seek a natural way to manage their condition. As a wider diet therapy, so you will need to do other things. I found that I have to do a number of things to manage to get the condition under control. Some of it I have to do, I manage myself, and some of it has been I have needed intervention, medical intervention, as I did the last time. But generally, the aim of it is just to try and maintain your uterus, so you have it so you get through the menopause, so you have it once you go into menopause, because having a uterus into menopause offers some protection against osteoporosis and cardiovascular disease. That's another topic that I'll talk about. So thank you for watching today. I'd just like to make the disclaimer again. This information in this presentation is intended for information only. Further research I suggest you do. It's recommended to assist you in making an informed health decision. It is not a substitute for medical advice. If you have a pre-existing medical condition, please consult your doctor or healthcare provider before making any changes to your medical regime to manage your condition. And my name is Sandra Williams, and I'd just like to thank you very much and have a great day. Bye.